Hi, I'm Stacy. Today, Adam, Beth, and I are going to be talking a bit about substance use challenges and people who are unhoused. In 2019, in America, nearly 600,000 people were experiencing homelessness. About 396,000 of those were individuals, 171,000 were families, 96,000 were chronically homeless individuals, nearly 40,000 were veterans, and 35,000 unaccompanied youth. Here on the bottom you can see the varying degrees of sheltered or unsheltered conditions these folks were experiencing. In Travis County, they assess homelessness by getting volunteers to go out on one particular night to go and count the homeless folks they find. And on this particular night, they found 2,506. Of those, over 1,500 were unsheltered and almost 900 were sheltered. It's important to point out that apparently on this particular night there was some sort of plumbing issue at one of the shelters which caused it to close. Of the folks they counted that evening, most were over 24 years old, 18% were under 18, and 7.5% were 18 to 24. Most of the folks that particular night, 90% were not veterans and 10% were. The breakdown of ethnicities on this particular night was 60% white, 36% black, 1% Native American, 0.5% Asian, and 0.4% Pacific Islander. More of the people experiencing homelessness on the night they did this count were male than female. So there are a lot of risk factors in substance use and homelessness, but one of the most telling is the adverse childhood experiences, and we call these ACEs. So there is an assessment to determine your ACEs, your score, your ACE score, and most of these things, these childhood experiences, are things like experiencing physical abuse, emotional abuse. It can be a divorce, it can be abandonment, neglect, and fairly universally these people with adverse childhood experiences are more likely to use substance abuse and experience homelessness. What's more specific to homelessness is and substance abuse is the indirect or direct street victimization. So there is a correlation between being victimized on the street and substance abuse, and also witnessing other people being victimized on the street to increase substance abuse. Another risk factor related to trauma is the desire to numb feelings or avoid thoughts, and those might be feelings or thoughts as a result of adverse childhood experiences or of street victimization or perhaps mental health. There are also some homeless lifestyle risk factors that contribute to substance use, and one is the normalization of substance use in street culture. Another is just transience, is moving around. The more folks move around, the more they might be likely to use. The longer someone has been without a home can increase their risk of using, and illegal methods of earning income is often tied into drug use and often will lead to more drug use. So one of the great things about resilience is that resilience can continually be built, that even into our adulthood we can build resilience. Social support and mindfulness may mitigate adverse childhood experiences and build resilience in adults, and adults can learn resilience skills. Hope and belief that people can make positive changes, that it's possible to quit using, and it's possible to get off the street and into a home. The use of social coping methods. So the more peer support there is, the more support there is in institutions, the more successful people can be in stopping using. So, unsurprisingly, there are a lot of barriers to treatment. The lack of safe housing is obviously one of them. Even shelters can be triggering places. They can be loud. There can be people using shelters. And even outside of shelters, obviously, probably be, it can be a place where they witness violence. It can be a place where they witness a lot of drug and alcohol use. There are a lot of practical and logical barriers to treatment when you are without a home. You might move frequently, so it can be difficult to access consistent care. Child care is often an issue. Transportation issue. If you are not, if you don't have access to a car, or your treatment facility or your meeting isn't on a bus route, it can be difficult to receive treatment. No insurance and low income are obviously barriers to treatment. Another barrier to treatment is the lack of information about treatment. If you are not connected with a shelter or some kind of support system, you might not know where and how to access treatment. There's a lot of need for treatment in this population, and the waiting list can be long, and there can be a lack of capacity at shelters and treatment facilities. Some folks experiencing homelessness may not have a phone to access information about treatment, to connect with sponsors, or to be accessible by other people. And even people who are experiencing homelessness who have jobs often have uncertain schedules. They might work at a fast food place or some other kind of shift work, which is an inconsistent weekly work schedule. Also, personal barriers to treatment. If people are in denial about their substance use challenges, or they don't want to get sober, or if they feel a lot of shame about the substance use challenges they're experiencing, that can be a barrier to treatment. Guilt regarding relapse can be a barrier to seeking treatment again. There can be some real or perceived stigma from the shelter staff or healthcare workers that these folks might be interacting with in regards to their lack of a home that may be around substance use. There may be some stigma of, you are a user and so you don't deserve our services. Or the stigma may come from the other direction, where in the substance use treatment facility or in a meeting, they might be judgmental about the person's lack of a home. Also, if people are needing to prioritize basic needs like food and housing, treatment might be very secondary on their list of priorities. Treatment can also interfere with work. If folks have a job, especially if it's a new job, they might have really inflexible schedules, and the treatment might be a pretty inflexible treatment modality. There can be a lack of social supports. Many times when people are experiencing homelessness, they might be estranged from family, and in a different situation, perhaps that family would assist with information, transportation, child care. Folks might feel unwanted in recovery meetings if they're experiencing homelessness. And there might be a lot of difficulty finding and trusting a sponsor. It might be difficult to trust a sponsor who's not experienced being without a home or struggling with issues regarding money. And if that person is moving a lot, it can be difficult for the sponsor to maintain that relationship as well.